It's great to have you on the programme today. I've been looking forward to speaking to you. What do you make of the report?
I think it's a really well-written report. I think he's done an excellent job on making a diagnosis. What he's not done anything about, of course, is treatment. So actually the problem, and he makes an excuse that we can say that this was not part of his remit. Whether it was or not, I mean, he certainly poses some things which can give you an inkling of what you might do. But there are no solutions that he really poses, which you can see in the report, which is fair enough. I mean, but it means something really important. It means that we've got to do something actually about what the report is saying, and that means further investigation of the issue about the solutions. And I think that's a really interesting question, which people haven't really talked about. And you've got to look at the solutions as a whole, not individual bits of it, I think.
You see this as the thing, because I feel like, look, the report is obviously very helpful, but you probably don't need a report to tell us the NHS is in a really bad way, right? You just have to try and get a doctor's appointment or go to your local hospital or whatever it is. The difficult thing, like you say, is a solution. What do you think needs to actually happen?
I think we need to have a much more honest discussion, and I was a bit disappointed at Stephen Kinnock, actually, who I just heard on the programme. It seemed to me that, to talk about, the Labour Party is the one that's really always been in favour of the NHS and has, from the beginning of its inception and all this sort of thing. I've been a Labour member for a very long time. This is it's not a political issue, and it shouldn't be a political. It shouldn't be a political issue.
It's too important.
It's got to be by decision of a much broader community, and I think a real discussion would mean actually a proper look at the whole thing in an apolitical way as far as possible. And one solution, of course, is first of all to decide how much money we're spending on the health service, and actually in a way we don't know, because one of the things the report doesn't tell us is what the actual treatments are costing individually, and that would be really interesting. But, for example, a hip surgery would be so much in one place and a different in another place. And the question really is, why is that and what is needed? Part of that is NHS England, but it's more complicated than that. And then I think once you've got the whole thing in the picture, you've then got to decide how you fund that amount of money. One solution, obviously, I'm afraid to say, although the Labour Party won't want me to say this, but much as I'm, hugely supportive of Keir Starmer, I think we have to ask ourselves whether or not we need to consider how much we can afford to spend and where the shortfall will come in forms of some kind of extra funding, which might be obviously an insurance scheme, which is done in some countries, or some other hypothecated tax, or where we accept people have to pay a bit. When there was a big crisis back in the year 2000, I got myself into trouble with Tony Blair.
You're about to do the same, I can see, aren't you? You're bracing yourself. You're like, I'm going to get the call after this programme.
He was great. No, he was great because he really listened, and he put a huge amount of money in, which solved the problem for a while. But inevitably, this is going to happen again and again because the price of healthcare is going to continue to rise. The technology we're talking about in this report is going to get more and more expensive out of proportion to the actual amount of money we're putting in. It's bound to. So you've got what patients expect, but the expectation is always going to be below the line, which is the cost going up. So that's one of the problems. We have to really think, and this is a very good time to do it, because you've suddenly got a government with a massive majority. Therefore, it's not going to be unseated if it's sensible. It doesn't need to be too nervous to actually say, well, let's really be radical. And one possibility might be really to say, how do you accomplish getting that shortfall made available?
I mean, look, there'll be some people listening to this thinking, their kind of hearts beating. As soon as you start talking about insurance, about paying for parts of the NHS, people get worried. They get worried that people will not be able to access healthcare if they haven't got the money, right?
Well, in the year 2000, what, of course, I suggested to Tony Blair was that what we might do is to bring private practice into the NHS hospitals. Actually, that private surgeons could only work in the NHS. We didn't have many clinics in that time. It turned out to be a really good idea because the people who then built private clinics made a massive fortune, and now, of course, it's nearly all foreign money. We've missed that opportunity. We could probably do something like that still in education, but that's another time. We'll come to that now. But I think here, I'm not saying we should necessarily have a hypothecated tax or insurance, but I think it's something we need to be discussing very, very carefully and seeing where it slows down. And I think, one of the problems is that, it's a funny thing about humans. They don't really value what they don't pay for. Actually, that's a big problem. A lot of people don't value their health service. They say they do, when there's a crisis, for example, during the pandemic. But maybe we have to accept that we have to find some way of paying for some of the costs of the health service, in a way which is not impossible and finding how we could means test that if necessary. I mean, after all, it looks as if we might be doing it with winter fuel payments. Dare I say that?
Yeah.
But I mean, on a much bigger scale, there are some clear issues here. There's three really big issues. One clearly is mental health, which is massively important, where in fact there's a huge shortfall of ability to do it. Secondly, I think there's obviously, as Darzi rightly points out, one of the issues is the issue of primary care. And of course, what was just being spoken about by Mr. Haldane, of course, was the issue of investment in the infrastructure. And, you know, that's really important. You can't get away with crumbling hospitals. You know, there are some hospitals in London, there's one in particular I'm thinking of, where the passageway through the hospital from one side to the other is like going into one of those tunnels in Gaza. And that's not acceptable. And, you know, patients perhaps are going through that as well. In fact, they are on trolleys sometimes. So, you know, I think we have to really understand that we have to do something quite urgently about the structure.
I could talk about this for a long time because it's a really, really important issue. Do you think the NHS is trying to do too much? Trying to do too much? You know, whether it's, you know, dentistry or whether it's fertility treatment or whether it's is this just too big?
Well, I think, I'm sure West Streeting is finding that at the moment, and I know that, you know, previous secretaries of state have said that in the past. But, you know, at the background, of course, you've got another issue as well, which we haven't really talked about, which is social care. And that has to be solved. And clearly, that's got to be funded. And you can't leave it as it is. The other problem is this, and may I bang on, or do you want me to stop?
We haven't got loads of time, but go on.
Well, one of the issues is preventative medicine. You know, it's true, of course, we've got people dying younger than they need to. But, of course, the longer you keep people alive, the more multi-morbidity they have, the more extra diseases they get, therefore the more cost they are to the health service. You could argue that preventative medicine is perhaps not such a good way of saving money in the long term. I mean, perhaps if everybody smoked, it would make the health service cheaper, not more expensive.
Well, there you go. I mean, this is the thing, isn't it? Because we all die of something, right?
We all die of something. I mean, I know I'm being a bit flippant, but nonetheless, there's a serious thought there, which I think we have to think about. How
if we get healthier,
yes,
it may also be more costly, effectively. Yeah. Thank you very much indeed. A lot to ponder. That was very, very interesting. Thank you.